Just as a reminder, my name is Adam. I'm the communications officer from the MRF. As you might have guessed now, I am not Lauren. I just play her on TV. That's going to make more sense for folks actually watching this on a screen, but you in the room, just bear with me, please. So today, for the very first time, this is truly a historic moment, and I'm excited and proud to be the understudy that got to step in and present this to you. But for the first time, we have organizations from 4 nations, all dedicated to ocular melanoma, bringing together, really probably for the first time in history, just to share what you are each doing and what we're doing together. So by ways of very brief introduction, and I'm doing them a disservice because these are truly outstanding individuals and organizations, so please read about them in your programs. But for the sake of time, to briefly introduce, from Ocumel Canada, we have Natalie Richardson, who is the acting director of Canada's Save Your Skin Foundation and the co-founder of Ocumel Canada, which was in February?
Yeah, in January, yes.
January. So yeah, the newest partner on the block, and we're so happy to have you here. Thank you. And we also have from Ocumel Canada, Mr. Nigel Deacon, who is the co-founder of Ocumel Canada and on the steering committee of our very own Cure OM initiative. So he's sort of wearing 2 hats today, and we thank you. Joining us remotely from Ocumel Ireland, we have Joan Finnegan, who is an ocular melanoma caregiver, as well as the co-founder of Ocumel Ireland. Also on the screen hi, sorry, need to go fast there. Also, we have from Ocumel UK, Ms. Jo Gums, who is the Executive Director of Ocumel UK, and she's joined by Neil Pierce, who is the Board Chair and Co-founder of Ocumel UK. And last but certainly not least, we have Sarah Selig of our very own Cure OM, who you have heard from already today or yesterday, and you're going to speak a little more this morning. And with that, I'd like to hand it over to the presentations. Joe, if you don't mind, can we go to you first from Ocumel UK? Maybe?
Sorry, I thought you said Joanne Finnegan. Hi, I'm Jo Gums.
Should we just tell them about the history?
Yeah, so we started Ocumel UK back in 2009 and sort of re-established ourselves in 2011, took on a board of trustees and sort of worked out how the organisation could really help people affected by ocular melanoma. And from there, we've just really grown year on year, and we started working more closely with Cure OM and various bodies in Europe to see what can be done now to sort of move into the realms of research.
So we're looking to expand what we offer to our patients as well. At the moment, we're looking to employ a support nurse who will be a full-time post and available to give specialist advice to our patients and carers wherever they may be.
Okay, fantastic. Thank you very much. And if we can jump just a little ways over, and Joan, could you tell us about Ocumel Ireland, please?
Hi there. Can you hear me okay?
Yes, ma'am.
Yeah. My name is Joanne Finnegan, and I myself and 2 other people affected by uveal melanoma started this organisation not too long ago in October 2017. So we're sort of early days yet. I guess initially we got a lot of support, I would say, from Ocumel UK. I just wanted to mention them firstly. But we are an independent organisation, you know, like everybody else, we're volunteers, and I guess like everybody else, all the other countries from what I've kind of gathered online anyway, is that there was nothing for uveal melanoma at all, and everything sort of related to skin melanoma. So just in terms of, you know, supporting people in our community with giving them options around treatments and giving them some knowledge around the actual disease as well, which is, as we know, very rare, but it's got the highest rate probably in the world here in Ireland. So we are small. We're 5 million in the Republic. But it looks like, if I just want to give you figures there, if you'd like them now, it looks like we have between 11.5 and 17.2 per million, which is pretty high in relation to, say, the UK and America. But I suppose, I'm really glad that we're able to attend on behalf of everybody in our support group.
Thank you very much for the warm welcome. I'm going to actually just hand it over to Nigel just to speak a little bit. I know you've already heard a bit about him and you know Nigel's background, but I'll let him just do a brief introduction of how we came to work on this project together, and then I'll give you a little more information about myself, and then Ocumel Canada.
Thanks, Natalie. I'm Nigel, and I live in Canada. I was born in Ireland. It sounds like maybe that's why I got this disease. I had a lot of trouble accessing help in Canada, especially when the cancer metastasized in 2012. So I found myself traveling quite a lot to the States, where the expertise for us really lies. And I visited Pittsburgh, Philadelphia, and Los Angeles in search of help. When I was at home, I reached out to see who I could work with to improve the situation for others who ended up with this cancer. And I made friends with Kathy Barnard, who founded the Save Your Skin Foundation. She is one of the very early survivors of cutaneous melanoma, thanks to immunotherapy. And she leads an incredibly effective advocacy organization in Canada called Save Your Skin. It didn't take me very long to find my way to Cure OM and to make friends with people here. This is the third of their annual conferences that I've attended, and I was very surprised recently to be asked to join their steering committee.
So enter Save Your Skin Foundation, which has played a very important role in my life the last few years as well. 5 years ago today, actually, I was diagnosed with stage 3B nodular melanoma, which set me on a journey with cancer that I didn't expect, nor did I know anything about. So I didn't have a lot of support in my local area as well. And I managed to find Save Your Skin Foundation by chance in an online forum, in a group much the same as this, only quite a bit smaller. And I did some volunteering for Save Your Skin Foundation and just got to know the group there and had great amount of support from them. And when it came time for me to, after my surgeries and treatments, it came time for me to think about going back to work because I was going crazy, not doing so. I talked to Kathy, who was my very good friend at that point, and said, okay, you have to hire me because I need to work in this field and try to help people who are going through the same things that I've experienced, which so many stories I've heard this weekend are so similar, just on a different kind of cancer, but similar. We all have very similar struggles. So that led me to begin to learn more about ocular melanoma when I met this lovely gentleman, Nigel. And Kathy and Nigel had worked together for a couple of years before I came along, and it was time to help Nigel and support him in a way that we felt that we could and we wanted to, and then in turn he could outreach to other patients in the same situation. So it all started last year in January 2018 when Nigel wrote a blog for the Save Your Skin website, and it really inspired me to ask him, what is this rare disease that I just don't know anything about. So he very patiently began teaching me all of the things that we've been learning this weekend, and it's taken him a long time but he's very patient, we'll just put it that way. So from February to July last year, we did a survey a Save Your Skin Foundation survey, Understanding Ocular Melanoma in Canada, which assessed the experiences of Canadian patients with ocular melanoma, their care plans, and their opinions of the ocular melanoma treatment landscape. We're pleased to find an adequate number of respondents who, by sharing their experiences, confirmed our suspicions that more and better support was needed for OM patients across Canada. We have provinces across the country, I guess sort of like you have states, only our provinces in our healthcare system, our approval processes are different for treatments in various, well, every cancer indication, but ocular melanoma being a rare cancer and our numbers being small because we're just smaller in population, our care isn't consistent from the West Coast to the East Coast to the middle where I live. So the problems that Nigel has identified are affecting a lot of people, so we want to try to make it more consistent across the country. So we set about a working plan, began compiling all of Nigel's extensive research. I have documents across my desktop like you can't believe, and developed the concept that would become Ocumel Canada. So just a little recap of what we've done in the last year. After the survey of patient experiences and needs that we've learned about, what directions we want to take in order to help support them better in Canada. We've put together a strategic plan that we hope to put in place. It's still very early days for us, but our kind of guideline for what we want to do is outlined in the web space that we've put together, a few pages on the website. And before we developed the actual name of Ocumel Canada, we did, Nigel already had a lovely relationship with Cure OM, and so we talked to them, and then we got in touch with Ocumel Ireland and UK because we really liked the idea of having that unity and that teamwork to say, you know, Ocumel Canada, we can make a larger group and project that all of us could collaborate on and share best practices and really build that community. Because it's small in Canada, we could get support from other countries and give support if we have ways we could do that. So we reached them and kind of came to this consensus that we would be able to work together that way. We launched Ocumel Canada, and the few pages that we put together with links from all over the world, with resources and the latest updates that we've learned from attending conferences like this, or just online links and articles and different research pieces, and compiled them on our website to offer them to the public. And we did the official launch of Ocumel Canada January 15th of this year. So it wasn't that long ago, but it feels like, you know, it's been a very busy few months and very exciting. And then quickly after that, we had a webinar, our first webinar on ocular melanoma. So Save Your Skin Foundation does educational webinars, much like the MRF does. But this was our first on ocular, and we were really honored to have a specialist from Toronto, Dr. Marcus Butler, and then a friend and specialist also from Los Angeles, California, Dr. Hamid. And they discussed, you know, they gave a brief overview of ocular melanoma and then current treatments and the landscape of how care pathways are going in the United States and Canada. So we're hoping that our Canadian physicians will be able to use that information and help inspire them to be consistent across the country and offer what may or may not be available to Canadian patients, or at least advocate for it. So since then, we're continuing to plan for the rest of the year, and I'm going to hand it at this point over to Nigel for what our next steps are and what we hope to do, because he's really the boss of this project, and we are happy to take his lead on what we need because he knows this community, you know, very well, and so we endeavor to support him in that.
Thanks, Nat. I'm not the boss of anything, not even myself. But I am brave, and so what we're going to do next is we're going to do what we are calling a cross-country checkup. And we're going to get information from all of the cancer agencies across Canada as to how they currently describe the disease, what kind of information they collect, what the protocol is when somebody is newly diagnosed, how do they work with the primary cancer, how do they work with the metastatic cancer. We're going to put all of that information together and then feed it back basically to all of the patients and all of the agencies. And that will be the first time that we'll have any idea as to how different treatment is from one place to another, and whether there are major gaps in the way that we try to help people. We're going to focus on building longer term a sense of community, a sense of family. It's incredible when you come here to the CureOM meetings and you meet people who, for the first time, who have this cancer and who have lived with it for some time. So we have to do that, and I'm sure it'll look very similar in some ways to what CureOM has been doing here since 2011. We move to slide 5. So looking further ahead into the future, we're just dreaming that if you're diagnosed with this cancer, you won't feel so terribly alone and so terrified. We dream, of course, that treatment will improve. There are already way more options than there were when I started my journey in 2010. So our future certainly looks bright, and I'm sure it will be brighter still. We're very interested in trying to help people learn how to live with the disease. And CureOM has been inspirational to us. You know, in everything that you do, you could see the CureOM presence, and we're immensely grateful for that. We're also very interested in, we chose the name Ocumel Canada because Ocumel UK already existed and Ocumel Ireland was appearing. And so there may be a time where we will all just be Ocumel. Wouldn't that be nice?
I just wanted to say thank you as well for welcoming us here, well, welcoming me, because I know Nigel's already, you know, part of your community and you know him as well, but thank you for the warm welcome and for sharing your stories. This has been the most inspiring weekend and symposium I've ever been to, so thank you very much for sharing, and the work that you're all doing is incredible. Thank you.
So I think you all know me by now. Sarah Selig, internist and public health professional at Brigham and Women's Hospital and Harvard Medical School in Boston. And you know, I've talked a little bit about CureOM. Maybe I can just give a couple high-level kind of overview thoughts, and then just kind of a reflection on just the juxtaposition between the previous panel and this panel that I've just been thinking about, listening to all of my colleagues speak. So for those of you who didn't hear my talk yesterday, ocular melanoma is not my clinical expertise. I got into this when I was 29, a fourth-year medical student, when my husband Greg was diagnosed. He was 34 at the time. I'd never heard about ocular melanoma in medical school, and would have probably gone much of my career without hearing about it, I think, in internal medicine. A year later, after Greg and I had moved to Boston for me to do my residency, he was diagnosed with metastatic disease, so at his one-year checkup, we were told he had 6 months to live at the time. And he decided that that was unacceptable. And he lived another 4.5 years. And I think much like the Colberts were saying, I really related to how they described Billy and Keenan's experience, because we didn't want ocular melanoma to define us, and we wanted to live. So we packed a lot of life into those 4.5 years, and we're very lucky. And during that time, I think part of what allowed us to have those 4.5 years was advocating for ourselves, advocating for Greg, and researching and seeking out treatments, and being innovative and creative, and Greg convincing some of his doctors to try things that they maybe didn't want to. and really, really seeking out different options. And as we were doing that, we realized that we needed to expand that advocacy so that it wasn't just internal for us, but we needed to face it externally for the community at large. And so one night when Greg was receiving an intravenous dose of whatever phase 1 clinical trial he was on at the time, the clinic had long since closed, and we were the last ones there in the infusion center. And we had been so hopeful this was going to work, but we were coming up on scans, and I remember saying to Dr. Shapiro at the time, well, what if this doesn't work? And Dr. Shapiro was a lung cancer specialist, but he was overseeing the phase 1 clinical trials at the time. And he said, well, Sarah, the ocular melanoma community isn't organized. Like, you need to look at some of these other communities and look at the advocacy and the organizing that they've done. And that's what the ocular melanoma community needs. And so I thought, okay, well, then that's what we need to do. And so, Greg would sit in the chair and have the chemo infused into him, and I would sit next to him in the chair, and I was on my computer and organizing and emailing and getting people together and planning our first science meeting and then planning our first patient meeting, and it was sort of one step in front of the other. And a lot of amazing people, a lot of whom are sitting in this room or right outside of it today, who really helped kind of put each block on the foundation and the next building block into where we are today and hopefully where we're growing, which I hope you've heard about this weekend, really in the areas of patient education and support and research and advocacy. And I think, specific to this panel, I guess, thinking about the panel just before it, and for those of you on Skype, we just had a panel about the unique populations in Huntersville and Auburn, Alabama. And it sort of just strikes me that was sort of a hyper-local panel, if you will, looking at these unique populations in these two specific areas. And now we're telescoping out to this global level and seeing what's going on at the global level. And I think that what it takes is connecting the two. We have to be seeing these unique populations and understanding at the very hyper local level what's going on, and then we need to telescope back to this level, and we all need to be working together to not only support patients but also to move research forward. And so with Ocumel UK recently, we've had some very exciting conversations about pulling together as global advocacy organizations to develop a research blueprint. That's already been in the making over the past several years, but if we as advocacy organizations really band together at the global level and are able to develop those priorities and that blueprint, we have a very dedicated research community globally focused on uveal melanoma. And how can we make sure that priorities are clear and that we are leveraging the resources that we have in this relatively small community. And so I think we're well on the way to be able to do that together. And I think that this community of people represented at the table and on Skype has been so amazing. And when we're able to kind of leverage the strengths of each person involved and each organization involved and put those pieces together and understand how those pieces coming together sort of elevates the whole community and the whole cause, I think, we will get to those effective treatments and we'll get to that cure together. So this group of people and everyone in this room really provides that inspiration to me, and I know that we'll get there.
Great. Thank you so much, everybody. Wanted to open it up to questions. So we sort of had, excuse me, a prepared list of questions, but our intrepid panel of speakers more or less addressed everything that I thought of ahead of time. So kudos to you all. So to the room, I mean, this is your opportunity. You have these 4 outstanding organizations ready to speak to you. So does anyone have a question that we can address? Is that a hand? Nope, that's waving. Okay, well, I'll kick it off. So Sarah, you sort of very well segued into this, I think. But if I can ask just each organization within your own organization and within your countries and your communities, what do you see as the greatest area of opportunity? What is that unmet need that you feel that we're right on the precipice of addressing or even solving And what does that look like? What are the international collaboration opportunities, and how might those address them? And I'll just open it to whoever would like to go first.
Yeah, I think what's special about the community is how we've actually all come together. Everyone here has been affected by ocular melanoma in some way, and the fact that we're talking, as organisations, we'll be talking to each other weekly going forward, sharing best practice, not trying to reinvent something that another organisation has already done. I think will really save a lot of time, but I think it will also help us identify, like Sarah was saying about, what research is it that the community wants to support? What is it that we can identify as an importance for our community, and make sure that that voice is heard, rather than when clinical trials are done, us being the last point of call and it's a quick tick box. It's actually been at the beginning of that process, making sure that the clinical trial suits our community, and we're working with pharma at those beginning stages. So I think there's a lot of exciting work that's going to be coming out in the next year or so, where we'll establish ourselves as a global community who are talking to each other and working with each other closely.
Yeah, and this is Sarah, and I would just add to that, Joe, that I think we've had some interesting conversations recently about our individual interactions with industry partners. And now that you guys are on board too, I think that'll be an additional group. And I think we've talked recently about, well, how can we leverage those conversations? How can we, not only in the research community, but also with industry partners, how can we come together as advocacy organizations and prioritize the conversations with industry and with funding from pharma partners as well, and with research and development with our industry partners. So I think that, we're sort of at the beginning stages of talking about that as sort of a corollary, if you will, to the research conversation. And also just to mention that another piece of our research agenda, which is the registry, which we talked a lot about yesterday. We've had 2 in-person meetings with Ocumel UK in the past 5 months, where we've gotten to talk about that, and we're very eager that this group of organizations, because we'll be launching in the English language first, although the registry will have the capability to be translated into other languages. We think this group probably represents kind of our first launch of the registry, and we'll be relying on this team of folks as really close collaborators and partners to be able to carry that off. And also, we'll be able to do different surveys in the registry for different populations. So, Ocumel UK, Ocumel Ireland, Ocumel Canada, you all can decide what additional questions you want to be asking your constituents beyond what, sort of the base of the registry is. And so I think that's going to be a real, another key area where we'll need to be working together.
I think I would just relate 2 things, and one is there is strength in numbers. Our population in Canada is 40 million, and we think that there are perhaps 200 patients diagnosed a year with primary OM, but we don't really know. And the estimates in the States from a population of 370 million range from 1,500 to 2,500. The margin of error seems to me enormous, but I better not say too much about that. Europe has a much larger population of 550 million, but if you count all of the ocular melanoma patients together, that has the potential to be a really powerful voice. Sometimes one voice is powerful. We've listened to some very individual powerful voices this morning here in this room from Huntersville. And then I want to relate that to the registry, which CureOM has been working so hard on for several years already, and it's getting very, very close to reality. And yesterday, I had been hoping that it would become an international registry, and yesterday I saw the word global in front of registry. Now that is an extremely exciting concept.
We would reiterate that the whole concept of collaboration globally, putting together this patient registry is enormously powerful. It's got the potential to drive many things and give us many answers. And the sooner we can get the registry up and running, the better from this perspective.
Absolutely. Dr. Brennan?
I think that the audience ought to recognize that Dr. Victoria Cohen at Moorfields is the incoming president of the International Society of Ocular Oncologists. So she represents ophthalmologists globally, and if their voice could be put toward advocacy and toward the activities that NeuroM promotes, the patient sensitivity and patient support, you could get some real powerful figures around the world.
Yeah, we know Vicky Cohen very well.
You know her well.
Yeah, we know her well. Joe's meeting with her next week, isn't it?
This Friday, there's an oncology group meeting being hosted in London by Victoria Cohen and her team. So we'll be there on Friday to meet the attendees, and I believe that's an international meeting. Certainly, well, European meeting, but I believe there's other people from outside Europe attending.
Thank you.
That's fantastic. Any other questions? Oh, sorry.
Could I, Joanne, when you talked about, Joanne, are you able to hear me?
Yeah.
When
The audio isn't very good. My end, but I'll do my best to hear what I can there, and I guess it was that in relation, the more people we have, more each other around the world, the better. And we've had good examples of that, to be honest, here in Ireland. We have, unfortunately, no access as a small country, to clinical trials. So we don't have any clinical trials here. However, we are kind of working on this so that we can possibly have something in maybe France or Germany in the future. But it's going to be all to do that. So we are very much trying to work for the smaller countries as well within Europe. We have some researchers that we're meeting now shortly in Dublin from University College Dublin, led by Brendan Kennedy, and he's doing some research with Spain. And we're just kind of making as much, trying to get ourselves out there as much as possible to let people know that we're there, because I reckon there's projects going on that we probably don't know about, So I think this is a really good start for us anyway, just to actually be here, attending the meeting, and to listen and to see what's going on. And I think we probably all have objectives for uveal melanoma. And we're all, some are smaller than others, some are affiliated with other organisations. But I think for us anyway, once we keep the patient at the centre, and we're doing the support and education, but also the research part, and trying to work with the scientific community is really important as well.
Anyone else while we're here? Cool. So in that case, by way of closing, I guess, we'll open it up one more time. So we sort of see that, barriers are coming down, borders are falling, the OM community truly is becoming global, as Nigel mentioned. So if I can ask each of you, and I don't want to put you on the spot, but I'm going to anyway, can you tell us, and whether it's in the next 3, 6, 9, 12, 18 months, what's coming up? What's a key initiative or an awareness campaign or something that we in this room or on this telecast can take part in? So I know just a couple months ago, the MRF was proud to wear the Ocumel UK eye patches. We distributed those around our office, and we were able to participate in that campaign sort of across the Atlantic. So from each of you, can you tell us one thing we can look forward to and how we can all get involved and help?
Yeah, I mean, from UK, we're looking to try and make sure that everyone around the world knows about support networks that they can get in touch with. So we've developed a website which is eyepatch4.com, and in there it lists all the organisations that are taking part in today's talk. So if anyone in the room knows of other ocular melanoma organisations around the world, we can add that to the site. And it's not about promoting any one organisation at all, but just a way that people can show, why they're matching, a conversation point, encourage people to go to have their eyes tested. But it's to find, essentially it's for people to find support networks in their own country, to learn more about ocular melanoma, just raise the awareness as much as they can. So with the organisations we send out, there's literature for each organisation to customise and share with people that you're in contact with. But anyone is free to sort of take a look at the website and download materials that they can to take part.
Later this year, we're also looking to reconstitute our ocular melanoma guidelines group. We published guidelines a few years back, which Ocumel helped to drive, and we've been in contact with people involved in the panel before. We want to get that off the ground again, because we think there's enough evidence coming through over the course of the next year to make it really worthwhile. And it's always about timing. We don't want to put the guidelines out and then find that some stunning results are published a month later, which invalidate them. But I think getting the ball rolling now, it looks to me as if there's going to be important data coming out. So it takes usually about a year to end up finalising the guidelines, I reckon, by the end of 2020, which has a good kind of feel from an ocular point of view. We'll be putting out some new 2020 ocular melanoma guidelines.
As far as from Canada, I can say we have a busy agenda. First and foremost, I believe in May is the iPatch 4 campaign. We're hoping to bring that to Canada as well. And in November, the Cure-OM I Get Dilated campaign, we're hoping to bring that to Canada in the fall, as well as our own work with our provinces and our provincial agencies and how to make care more consistent across Canada. But also we collaborate with the NCCN, the National Comprehensive Cancer Network, on their guidelines. And that reminds me, they do have clinical guidelines for uveal melanoma that were published last year. And we are discussing with them how we can collaborate on the patient guidelines, which are a little more accessible to patients, a little easier to read, and you don't have to log in to get them. Although, if you would like to see the clinical guidelines, I'm sure you link to them, but we link to them as well. So we're trying to encourage them to work on patient guidelines, and we would endorse that as well. Anything to add, Nigel?
Yes, thanks, Joe, for adding Canada to the iPatch map just in time for this year. I'm wondering, you mentioned the Cure 2020 project in Europe, which is extraordinarily well funded, and it would be nice maybe next time we talk if we could have some voices from there as well. Do you participate, or do you just get information?
We're a member of the Melanoma Patient Work for Europe group, so we have some information just from being one of those members, but we're Ocumel UK aren't part of the Cure 2020 project at all. So I do know that they do meet regularly. They tend to keep the website quite up to date. And yeah, if there's anything sort of promising out of there that they are looking to bring out of the trial, has probably got the most collaboration, in that clinical trial. They are looking to bring that out by 2020. So, we keep nudging them and, reminding them that we're now in 2019 and, we'd like to be hearing something soon.
Yeah, they've had their cards close to their chest. And, I think we'd all expected to hear more. More considering the amount of money that's been poured into this. Now, maybe there's going to be something massive they bring out at the end.
Yeah.
And that's what we live in hope.
Yeah.
Let's all
things
hope.
are looking good. I mean, I'm confident that there will be a clinical trial that does come out of, and if if there isn't, which I think would be a great big shame, they will have a great deal about the disease itself. So there'll be enough to sort of, put people in the right direction of where the next research needs to be taking place.
Yeah, and stimulus to pharma as well to maybe start looking down different avenues.
Yeah.
Yeah, can I just talk about that briefly? I did attend a couple of the conferences, and I think it's difficult to kind of get information, whether it's because it's sort of top secret and we're not allowed to know as yet, I'm hoping. But, we're sort of halfway through there a few months back, and I thought we would have got more info from it, but unfortunately we didn't. I did attend the conference, as I said. I spoke with the Paris team. I mean, we did make a connection there through one of the geneticists, which that's one of our I suppose, issues that we want to explore, and he was quite interested in the Irish population and the high rate. So I suppose we got something out of it for Ireland in a way. But I mean, we do link in. They've got their Twitter, they've got their Facebook page, but 2020 is coming fast, so hopefully that there will be something, but I wouldn't just depend on that at all. And that's why I think it's really important that we keep our eyes and ears open and do as much research and make ourselves more aware, make people more aware that we're out there and we're looking for this. We're still looking for this cure, and I guess we have. I suppose I'm a little bit more optimistic than I was maybe a couple of years ago, but I still think I still think we've got a long way to go to be realistic about it, and I'm hoping that when we meet again that we will have more sort of some good research for the uveal melanoma community.
I can say briefly from the CureOM perspective, we also want to support the Eye Patch 4 campaign, which was a campaign started by Ocumel UK. And so, as Adam mentioned, we'll be supporting that. Coming up for us, as you all, I think, saw, we have this new educational booklet that has been several years in the making, which is basically a new patient guide guiding an ocular melanoma patient through the journey. And so we're grateful to those of you who have given us feedback at the focus groups at this meeting. We will be printing those, and those will be, that's a free resource available. And to you all, on Skype and to you folks in the room, we'd be very happy for you to take that material if it's helpful to you and adapt it to your own settings. So we can definitely follow up on that, but that will be coming out very soon. As we mentioned, we'll have some big announcements about the registry coming up, and that's something that we're going to really need a lot of support and engagement in from the community as that's being launched. So we'll make a big announcement. You won't miss it when it's being launched, but we'll have a few steps that we'll be announcing along the way. And then our I Get Dilated campaign in November is coming up. And the other thing that maybe I'll mention is, every year we host somewhere between 1 to 3 scientific meetings a year. And we just finished 2 in the past several months, and one was actually in the UK. And the next one we'll be hosting is in partnership with the Society for Melanoma Research Congress. It's an international society, and that will be in November. And it just sort of impresses upon me that while this may be this historic time that all the advocacy organizations are coming together in a global fashion in this way, that we bring scientists together around the world throughout the year. And so I would love to see sort of some repeat of this grouping of us at our science meeting, if you all can make it in November. This year it moves around the world. This year it happens to be in Salt Lake City, Utah. But would love to see representation of this global ocular melanoma patient coalition, or whatever we want to call ourselves, but would love to see representation from this group of folks at our science meeting in November and beyond.
That was something. Thank you. For those that joined us overseas, for those in the room, for all of you that participated, again, I can't impress enough in a truly historic moment in bringing together 4 outstanding organizations. So as we close, just please join me in thanking everyone that came together today and for being a part of it.